Hi, I'm Jack Nicklaus. Golf was my game for decades, but now I'm focused on a new challenge, my heart game. I live with a rare progressive heart condition called ATTR-CM, or transthyretin cardiac amyloidosis. Getting diagnosed took years, so I'm spreading the word about the common red flags: A-Fib, shortness of breath, heart failure, and carpal tunnel syndrome. If you recognize these symptoms, ask your doctor about ATTR-CM and Vyndamax, the only once-daily pill that helps slow down ATTR-CM to help patients live longer and reduce heart-related hospitalizations.
Vyndamax is a prescription medicine used to treat adults with the cardiomyopathy of wild-type or hereditary transthyretin-mediated amyloidosis, ATTR-CM, to reduce death and hospitalization related to heart problems. It is not known if Vyndamax is safe and effective in children. Tell your doctor about all your medications, medical conditions, and if you have liver problems, are nursing, pregnant, or plan to be. There are no known side effects with Vyndamax.
I want to be here for the legacy that matters the most, my family. In health and in golf, it's important to manage your game. Take charge. Be informed. Ask your doctor about ATTR-CM. And tell him Jack sent you.
Before taking Vyndamax, tell your healthcare provider about all your medical conditions, including if you have liver problems, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including any prescription or over-the-counter medicines, vitamins, and herbal supplements. There were no known side effects that happened during treatment with Vyndamax.